Thank you everybody and welcome to this I3 session. We are very excited to be a part of this leadership webinar focusing on leadership skills and harnessing emotional intelligence to foster healthy, productive workplaces. It's a topic close to my heart, and we will be leading an IVF lab comes with unique challenges, and fostering a positive collaborative environment is essential for success. This session will explore key leadership strategies, the power of emotional intelligence, and how to prevent toxicity in the workplace. I hope you find insights on strengthening leadership skills, using emotional intelligence to build a supportive team, recognizing and addressing workplace toxicity, and creating a culture of success and well-being. In embryology, it is rare to get leadership training, and you are often promoted due to skills other than your management skills. It's your technical skills. It's your microscope skills and your good hands. But that promotion to management really relies on leadership training, and that's important. This is an important opportunity, this webinar. So please take part in the discussion. I'm joined by Professor Deirdre Zander-Fox, who has worked in ART since 2004. She's earned a bachelor's first class honors in obstetrics and gynecology and a PhD in reproductive medicine from the University of Adelaide, researching in vitro stress on embryo development. She's currently the Chief Scientific Officer of the Monash IVF Group and is also Scientific Director for Monash IVF Victoria and Repromed South Australia, and the Northern Territory overseeing embryology, andrology, and endocrinology services in these sites. She also holds an adjunct professor role at Monash University and associate professor at the University of Adelaide, is partnered on NHMRC research funding and supervises research projects and PhD students. So please, Deirdre, take it away. You're muted.
Gosh, okay. You think we'd learned that by now, but no. Thank you very much. I'd just like to reciprocate the introduction for my co-host, Dr. Michael Baker. So Michael is an expert in reproductive biology. He has over a decade of embryology and lab leadership experience. He's lab director at Inception Fertility, and there he oversees Aspire Fertility, Pacific Fertility Centre and Mainline Fertility, ensuring the highest quality outcomes and also regulatory compliance. He really does specialise in lab optimisation, staff development and EMR standardisation. And Dr. Baker also serves on the board of the College of Reproductive Biologists and Southwest Embryology Summit, fostering excellence in reproductive medicine. It is an absolute pleasure to be here this evening, or this morning as it is for me, and I think this really promises to be a really enlightening webinar. I think, as we mentioned before, please put your questions and questions and in the chat function, the Q&A chat function, so that then we can compile a list and we can begin to ask them at the end once we've heard from our two speakers. So without further ado, it gives me it's an absolute privilege to introduce our first speaker to you all, who is Jordon Swain. So Jordon Swain is a colonel in the United States Army and an associate professor at the United States Military Academy, where he teaches management and leadership courses and serves as an associate dean. He has over 25 years of organisational leadership experience in the military, having served in various command and staff positions both overseas and in the United States during peacetime and during war. Colonel Swain graduated from West Point with honours, holds an MBA from the Wharton School of Business at the University of Pennsylvania, and earned a PhD in Organisations and Management from Yale University. Jordon is also a graduate of Army's Command and General Staff College, Army Airborne School, Army Assault School, and US Navy Dive School. He's earned a number of awards, including the Bronze Star Medal, and he's published numerous papers and book chapters focused on leadership and leader development. And we're very, I think, privileged to hear from such an extraordinary leader today, and he's going to be talking about the IVF Clinic, Fertile Ground for Leader Development. So I'll hand over to you, Jordon.
Thank you for the introduction. Appreciate it. Good morning, good afternoon, and good evening. I'm going to maybe address the elephant in the room. Got a guy in uniform sitting here, and you might be asking yourself, what can this person tell me about how to do my job in IVF? And I would start off by saying that by being here, you've demonstrated an interest in leadership. And in the Army, and certainly in my chosen career path specifically, done a lot of thinking about leadership. Now, I want to start off with the definition here, because when we say the term leadership, depending on who you talk to, it can mean different things to different folks. And for the purposes of how we look at leadership, it's about providing purpose, direction, and motivation so that people can lead change. And so then that brings me, I guess, to maybe a second similarity in that when we talk about change, in the military, we operate in a rapidly changing environment, what many people now refer to as a VUCA environment. Back in the late 80s, at the Army War College, where they do some deep thinking about leadership, they coined that term, VUCA. I would argue that the military, like you, operates in this VUCA environment. As your industry has matured, you've got consolidation going on, you've got legal changes, regulatory changes, political changes that may be facilitating some of those things. And so you are operating in this VUCA environment, and that requires adaptive, innovative, flexible leaders to be able to navigate that dynamic environment. And I don't think I'm telling you guys anything new, because several folks in your field, including a couple on the line right now, have written on this topic and the need to develop the leadership skills required to provide that purpose, direction, motivation to operate in the VUCA environment in which you find yourself currently working. And so with that, again, trying to demonstrate that we do have some things in common, and that our ideas of leadership, I think, do lend itself to some insights that can help you. I want to start by saying that I'm going to cover three main points as we go through this. So 3 things that I think can help you succeed as leaders, providing that purpose, direction, and motivation in the VUCA environment in which you find yourself currently operating. And I'm going to do that through sharing 3 short vignettes or stories. And really, these are stories of failure. We can learn a lot from failure. And I think that the takeaways from these 3 stories are things that you can take with you to help not only yourself, but those you're in charge of develop their ability to lead effectively in this VUCA environment. And these are not all Army stories. I'm not going to sit here and tell you should lead like you're in the Army, but the first story is related to the Army, and it's about toxic leaders. So in the early 2000s, we had a Professor Reed at the Army War College in Carlisle, Pennsylvania, where some of our emerging senior leaders go through to get their various training. They get a master's degree that prepares them to achieve upper levels of command and leadership in the military. And what Professor Reed kept noticing was a common complaint or observation among these seemingly future general officers, that they had worked for bad leaders. And he coined the term toxic leadership. And he found about 80% of the student body that he was dealing with had witnessed a toxic leader, and about 20% had worked for one directly. And this was a problem that he brought up the chain of command, and that the Army decided, hey, this is something that we can't allow to happen. What we do, the people that we are in charge of, the missions that we pursue, it's too important to have these types of leaders in charge. And so started doing some analysis about how did we allow these leaders to rise to the positions that they were in. And what we found were that a lot of times these leaders are smart and they produce short-term results. And in this VUCA environment that we operate in, oftentimes people get fixated on these short-term results. And so we had these leaders who they served for 2 or 3 or 4 years at a time, and they were able to produce positive outcomes, but at a huge cost. The people they were in charge of got burned out. They would leave the Army or leave the organization, and that price we found was quite frankly too high to pay. That said, if you look in, I think, modern media now, the word toxic leadership gets thrown around a lot, and maybe too much. As we did some additional research, what we found was that, and what we wanted to clarify was that toxic leaders, it doesn't mean that every stern or standards focused leader is a toxic leader. And so we came up with some specific actions that toxic leaders engage in. As I mentioned, engaging in these behaviors we found caused burnout and really took a toll on the members of the team. And if you think back to that definition of leadership that I led with about providing purpose, direction, and motivation, these people relied on coercion and fear of punishment to get things done, which again, it can produce results, but they're not sustainable results, and the organization suffers. And as I mentioned, Professor Reed discovered or coined this term in 2004. We still deal with this issue now. And quite frankly, it's for several reasons. Sometimes if you're thrown into a new situation that you aren't prepared for, you revert back to what you've witnessed. And so if you've worked for a toxic leader, that may be all you know. And so then when you are put in charge, you revert back to what you experienced or witnessed. In our continued research, we've also changed the name. We no longer refer to folks who engage in these types of behaviors as toxic leaders. Rather, we coined the term counterproductive leaders. And we made that change for a reason, because the word toxic carries with it an extremely negative connotation. And we want people to reflect, to focus on their self-awareness. And you may find that, unfortunately, maybe you worked for somebody who engaged in some of these behaviors, but if you're really focus and reflect on your own behaviors, maybe you engage in some of these behaviors from time to time. And if we label it toxic, we found that people are perhaps a little bit less willing to look at themselves. You don't want to label yourself as toxic, but if you say these are counterproductive behaviors, that opens the door a little bit. And if you're really trying to improve yourself and improve your abilities as a leader, that may make it a little bit easier of a pill to swallow. And so we identified this issue in the Army. We've continued to study it and really have tried to focus on what systems, processes, and training can we do to stamp this out. And there's a long list of things, but one of the ones I think that has been the most effective was the addition of humility to our leadership doctrine. And General Townsend, who was in charge of our leader development program in the 2018-2019 time period, really keyed on the idea that humility can act, in his words, as an antidote to toxic leadership. Again, words mean different things to different people. And this is a great bumper sticker or poster on the wall. Humility, counteracts toxic leadership. But when you use the term humility, I've been studying humility since about 2014. Lots of different meanings depending on who you talk to. Humility, I will tell you, is not just modesty. It's not weakness. And so with that in mind, and after having talked to people for years about this, the Army went ahead, as it does for many things, and created a manual and included a very clear definition of what humility is. And I think it boils down to three things: being a willing learner, focusing on self-awareness, and being open to feedback. And so those things, if you think back to what behaviors a toxic leader engages in, those are almost opposite, or certainly lead themselves to engaging in behaviors that don't align with those toxic leadership behaviors that we talked about just a few minutes ago. And definitions are good, but I will tell you, having done this several times now, people immediately ask, okay, that's great. I see that definition. What can I specifically do? If I want to try to focus on my humility, what actions or behaviors can I implement? And so this is a list of specific behaviors that Dr. Brad Owens out of the Marriott School at BYU has come up with. And those who engage in these behaviors not only are perceived to be more humble, but derive the benefits that humble leaders have been shown to produce in the organizations they lead. So I'll leave that up there for a few minutes so people can get a good look at that. But you can see it aligns with the different behaviors in that definition of leadership that the Army added to its doctrine. Now, I want to say, having studied humility for several years now, it is not just a behavior for those who want to avoid toxic leadership. So you've done some reflection, you look at those toxic leader behaviors, and you can clearly say, that's not me. That's not how the people in my organization operate. That's wonderful. That doesn't mean that humility doesn't offer potentially positive outcomes for you and your team. Humility has been shown to reduce turnover, to increase team effectiveness, to facilitate creativity and innovation, a whole laundry list of positive outcomes that result from humble behaviors. And so ultimately, I think the consensus has been borne out over the last 10 to 15 years of humility research that humble leaders really do help in this VUCA environment, regardless of whether you've got a toxic leadership program problem in your program or not. In addition to some of those positive outcomes I mentioned, I'll just read a couple off here: lower turnover, improved information flow, enhanced creativity. It enhances or promotes ethical behaviors. It also encourages or creates an atmosphere of psychological safety, which is the second point I want to get to. And that psychological safety is something that leaders in a VUCA environment may want to focus on to improve the effectiveness of the teams and organizations that they lead. And so psychological safety is really about creating a culture or a climate in your team or organization where people feel free to speak up. They can share ideas, ask questions, and not be afraid of getting ridiculed for speaking up. And there's an example, I think, that really speaks to the value of having psychological safety in the teams and organizations you are in charge of. And that's comes from an expedition in 1996 that went up Mount Everest. It ended up being the deadliest day on Everest up until that point, May 10th, 1996. There were 4 different groups of climbers, experienced guides and some experienced climbers. They had a plan, but the conditions changed. Weather rolled in. A couple of the things they thought were going to be in place, the ropes that were supposed to be fixed, ended up not being fixed. Some of the groups ahead of them didn't proceed on schedule, created a bottleneck. Bad weather rolled in, and the leaders of that expedition didn't change their plan. In a postmortem, after 8 people ended up dying out of those 4 groups during that expedition, a postmortem evaluation showed that people didn't speak up. They didn't question assumptions. They had information that would have allowed them to adjust their plans and potentially save lives. But the people didn't do that. And so the postmortem suggests that a lack of psychological safety resulted in them sort of staying the course, not adapting to that VUCA environment in which they found themselves operating in. Unfortunately, folks perished as a result. And so the research bears out, not just because of the Everest example, but in lab studies over the last several years. Amy Edmondson's one of the preeminent researchers out of Harvard Business School on the topic of psychological safety, that it really does lend itself to adaptive, innovative performance. Now, a recent article came out. I've been talking about psychological safety for a few years now, and I'd been getting pushback from experienced leaders for a while of, hey, this seems a little touchy-feely, right? We want to create a safe space where people feel safe to speak up. But we have standards, we have protocols, we have rules, and we don't want people speaking up or deviating. Those things are put in place because we've got experience, we've been through these. They need to follow the SOP, the standard operating procedures, or they need to follow the plans that we have in place, and they're not wrong. And so Peter Capelli out of the Wharton School, just in the last year, came out with his study that said there is such a thing as too much psychological safety. You may operate in an environment where you don't want people to be innovative or creative, that there are these routinized, mundane tasks. What he did find was that low psychological safety still negatively impacts people's ability to succeed or excel in those environments. And actually, one of his studies was on nurses. And he said, hey, when nurses are on the floor, they've got a set way that they're supposed to do things. We don't want them adapting and being innovative or trying to get creative. But low psychological safety still negatively impacted their ability to perform those routinized tasks. And so, however, too much psychological safety, and there was no fear of failure, and people sort of went off the reservation and took risks that they didn't need to take, and performance suffered. And so it's finding that sweet spot, that average amount of psychological safety in those routinized tasks, and maybe a little bit more in those non-routinized tasks, which produces better results. Now, the next question people will ask is, well, how do I figure out what that average or that optimal level of psychological safety is? And I'll tell you, there's no easy answer to that. That's where the art of leadership comes in. Leadership's not paint by number, and it's not always easy. And so there isn't a perfect solution. Somebody can't just give you a piece of paper and say, this is what you have to do to find that sweet spot for psychological safety. But too little negatively impacts performance, and depending on the task, too much can make people maybe too cavalier and prone to take unacceptable risks. And so then you as the leader have to figure out what's that right level of psychological safety. And much like humility, people ask, well, what can I do to impact the level of psychological safety? And these are some of the steps that the research bears out. First of all, you got to make it a goal. So now that you know that psychological safety is a thing that you might want to examine to help your teams be prepared to operate in the VUCA environment in which you find yourself working, you got to make it a goal. If you've bought into the idea of being humble, double win there, you're going to automatically increase a level of psychological safety. You'll find a lot of times the people who are the loudest or most confident talk the most, and sometimes their opinion gets listened to the most. As a leader, you can take steps to make sure that people get equal voice. Take turns, reach out. If there is somebody who's quiet, maybe an introvert, reach out and ask them. They may not come to you. They may not speak up in a group. You as a leader can take steps to make sure that you factor in their opinion, make them feel more comfortable. And you might have to do that one-on-one, take the discussion offline, reach out to them via email, ask them for their input. And so it's not just those extroverts or those folks who aren't afraid to speak up, who are being heard and maybe shutting other people down in group meetings. And then addressing conflict. We could take an entire hour-long session on how to address conflict, but in a psychologically safe environment where you want to encourage people to speak up, you have to become adept at dealing with conflict. You can't just ignore it. You can't just shut it down. There are effective ways to deal with conflict. And so if you've taken a negotiation class, there's some skills in there, and there's some conflict resolution models that you can look at that may help you deal with conflict. If you're anything like me, early on in my career, I was sort of conflict avoidant, and I will tell you, avoiding conflict may be effective in some situations, maybe one-time engagements or or instances where the outcome isn't that high risk or isn't that big of a deal, but avoiding conflict is not an effective way of dealing with disagreements in the long term, and especially in an organization where you're going to see those people day in and day out. So digging in a little bit into conflict management can help you create that psychologically safe environment. And so that brings me to my third and final point for leading in a VUCA world is trust. Trust is essential, especially in organizations. I would say there are some similarities between the organizations in which we operate, in that we don't measure the success or failure of what we do just on a profit and loss statement. What we do, while different, the outcomes or the ramifications are more than just dollars or ROI for shareholders. And so convincing people to do things in a VUCA world requires trust. And you can't rely, I think in the introduction, I talked about how a lot of lab professionals are technical experts. That's great. And that's the first sort of component of developing trust, is developing that technical competence. But technical competence isn't going to get you to the level of trust that you need. And I think we can share an example or look at an example from a tragedy at Man Gulch to make that point. And so Man Gulch is a location in the Helena Forest in Montana. And in the late 40s, there was a fire there. And we had a group of smoke jumpers jump into that fire in remote Montana to fight that wildfire. And they were led by an extremely competent senior firefighter named Wagner Dodge. Everyone just called him Dodge. Most skilled, most experienced member of the group. And they landed without incident to the point where a couple people stopped to have lunch. And they were just going to go ahead and fight what seemed like an ordinary fire, nothing too dramatic. But then situation changed rapidly. The fire or the wind shifted, fire changed direction, and these firefighters found themselves on a 70% slope. So imagine 70%, almost a sheer face on the side of a mountain with a fire racing up behind them. And they were facing getting burned alive. Dodge had an idea that was untested, but senior guy on the ground, technically competent. And he had this idea of setting what is called now a backfire, where he lit a match to the waist-high grass, and the fuel for the oncoming fire then was gone. So fire can't burn if there's no fuel. So he set this backfire, yelled to his men, lay down here and we'll survive. None of them listened to him. They threw down their tools and they started trying to outrun this fire up this 70-degree slope. At the end of the day, Dodge survived. 2 other men survived, but of the 15, only those 3 survived. And so Dodge had the technical expertise. He had the solution. He told people, I'm setting this escape fire, lay down here and you'll survive. And they didn't listen to him. And ultimately it's because they didn't trust him. And so again, he had that technical competence, but he didn't have the trust. And Pat Sweeney, one of my colleagues here, has researched trust in VUCA environments for the last couple decades. And what he has found is what boils down to easy to remember rule of 3 C's: competence, caring, and character. And so competence, absolutely, you have to be competent. People are not going to trust you if you don't know what you're talking about. But as we saw with Wag Dodge, he was competent, didn't get the trust that he needed for people to follow him. You also need to be caring. And caring can mean different things to different people, but it's being present, not just barking commands from afar. If your folks are coming in on the weekend because of an emergency, be there. Shared hardship shows caring. One thing that we like to tell junior leaders in the Army as they're given their platoon or as they are given their company is, how are you treating the folks that have been entrusted to your care? Are you treating them the way you would want somebody to treat one of your family members. And if you're not, then you might not be demonstrating the level of caring that you should be to engender trust. And then the last C is character. Do you have the integrity, the loyalty, the respect? Do you demonstrate those behaviors? Do you lead by example? When people see that, do they understand that you got strong character? If you're lacking in character, you're not going to get the same level of trust from your team as those who do exhibit the character. So again, those 3 C's, competence, caring, and character, can help give you the level of trust that will help you and your team succeed in a VUCA environment. Ultimately, I think those 3 things, you can't go a day without seeing something in the leadership literature, the new fad. But humility, psychological safety, and trust are 3 things that I think, can focus on as a leader in yourself to improve your leadership effectiveness. And if you're mentoring or coaching those in your teams and organizations, help them focus on those 3 things: the humility, psychological safety, and trust. And that will, I think, set you up for success to not just survive, but thrive in the VUCA environment in which you find yourself operating. So with that concludes my talk. I'm open to any questions folks may have for me.
That was delightful. Thank you so much for giving us a leadership perspective from outside of the laboratory. I think you really touched on a lot of very valuable points that I've been focusing on early in my lab director career. I'd say one person did ask for some book recommendations. I'll share one of my own and let you share some more. Might be the same. I'm in the middle of a book called The Culture Code, and that is really resonating with what Jordon has been talking about: building safety, psychological safety, vulnerability, and purpose. Colonel Swain, do you have any other book recommendations?
I think Good to Great is a classic by Jim Collins, where he talks about level 5 leaders, and he comments that humility is really the thing that sets the great leaders apart from the good leaders. Not sure if his study included folks in the healthcare. Certainly not. I don't think he used folks from the IVF industry in particular, but a lot of these lessons, I think, do span professions or industries. The other one is, if we're talking about psychological safety, is Amy Edmondson's The Fearless Organization. There's some good insights in there for folks that are leading in a VUCA type environment.
I think I've got a little time for another question or two, but one question you posed was, where in the IVF lab do you draw that line for psychological safety between not enough and too much? I'd say one insight I feel like I've gained in the past few years is to make sure that your teams understand that you have their back as long as they're following protocol. I think that's been a good rule of thumb for me. If they're doing everything that is being asked of them and doing it well to the best of their ability, I've tried to avoid financial penalties for accidents and better training and education when protocols fall short. But I let everybody know the buck stops with me and my protocols. So do you feel like that's a decent place to draw that line?
Yeah, I think it's a blend of having if you've got standards, mistakes happen, and they talk about when you're trying to create a psychologically safe environment, failure isn't without consequence, but honest failure, vice somebody, skipping, cutting corners or not following the protocol. And then you combine that with the caring, right? If somebody was an honest mistake, you can demonstrate your caring, as you said, the buck stops with you. But part of creating culture is people are always watching. And if you allow a careless mistake to go unpublished, people are going to say, well, standards don't matter here. And so again, this gets back to there is a science to leadership, but there's also that art. And I think I think Dean will probably talk a little about this, but as you do your own professional development, you'll start to figure out how to navigate these waters. Mentoring is a great way to get that right. You seek advice from somebody seek out advice from somebody who's got more experience, a senior lab director or somebody who's been there and done that, and get some advice, and that can help you in your leadership journey as well.
There was a question regarding that psychological safety being a problem in the medical field. How do we avoid that in the IVF lab with, well, I guess there was another comment asking if a toxic leader could be detoxed. I like that turn of phrase, but what can we do to avoid the dangers when we're under the leadership of challenging counterproductive management?
So that's tough, right? There's work about leading up, and this is where some political savvy may come in, right? If you've got a toxic leader who doesn't like to be told that they're wrong, the way you present your feedback or information becomes important. I would say a big takeaway, though, is not to be one of those enablers. Toxic leaders exist because they've got that dedicated group of followers that allow them to do that. And so at some point, you do have to not be an enabler. And if that means you tolerate it and you don't let their toxic behavior then permeate to those below you who are, in your charge, do you practice some of the conflict management skills and engage with them? Do you go over or around them? Again, there's no perfect blueprint, but I would say, having been somebody that did work for somebody that ticks almost every one of those boxes, the idea of it stops with you not letting it trickle down beneath you, I think is at least a good first step, especially if you want to start to develop the trust in the team that you're in charge of.
Very good. Yes, I've worked with and for some challenging leaders. I think a big part of that humility is recognizing that nobody's perfect. Not even a supervisor who's been doing this for 20 years is going to avoid making mistakes. Acknowledging that with your team goes a long way to building that trust and safety. Again, if everybody could put in their Q&As into the Q&A button and not just the chat. The chat is awfully hard to capture everything, as 500 or so, 600 people are pushing messages through. I will save some more of this discussion for the Q&A session after our next presentation. So if I can... Thank you very much, Colonel Swain. I will go ahead and transition over to our next speaker. It is an honor to introduce a founding member of I3 and a colleague, Dr. Dean Morbeck. Dr. Morbeck is the Chief Scientific Officer for Genea Fertility based in Sydney, as well as Adjunct Associate Professor of Obstetrics and Gynecology at Monash University, Melbourne. His previous leadership positions include Chief Scientific Officer for Kindbody, Scientific Director at Fertility Associates, New Zealand and Sunfert International Fertility Center, Malaysia, and Associate Professor in Obstetrics and Gynecology and Laboratory Medicine and Pathology from the Mayo Clinic. He obtained his Bachelor of Science from the University of Wisconsin, a Master's of Science and a doctorate in Physiology from North Carolina State University, and an MBA from Augsburg College. And I will go ahead and pass it off for our next fascinating presentation. Excited. Thanks.
Great. Thanks, Michael. And I'd just like to say what an honor it is to be here. And that for one, to follow that incredible talk by Colonel Swain. My journey in this leadership thing, there's, talked about the different leadership roles I've had in my career. But I actually started leading back in high school, not even realizing it. And I was leading the band. I was a drum major. So for those that know the US, I'm a band geek and I was a drum major. I didn't ever think of myself as a leader until I took a leadership class during my MBA over 10 years ago. So about the time I was 50. And it was an eye opener. And so I like to share that because we often maybe aren't realizing that there's this whole discipline and all these things that we can learn about being leaders that's out there. And therefore, as Colonel Swain shared, there's incredible learnings that are available. And I encourage you all to do that, to take that journey of learning more. So I'll just share my screen here. All right. Minimize this. And nothing of my disclosures influences this talk. So I was, fortunate to be part of a group that wrote this article on teaming and teamwork and how leadership is essential to a high functioning team. So, we talk about a team, but there needs to be a leader for a team. That's a given. It's pretty difficult to not have at least a person that's the point. And I think I'd also like to add in that, when we talk about our teams, we have our team, but we're part of a bigger team. We're part of a clinic team. And so we need to look at ourselves, how we engage with that clinical team to make sure that we're playing an important role for the culture of the organization within our clinic, if that indeed is possible. This is my favorite quote from this article, which, here's some of the things that Colonel Swain spoke about. Embryology teams thrive in a culture of safety and transparency, where all teams embrace a mindset of continuous improvement. And really, it's so important that as a leader, you set that culture of safety and transparency, that people will look to you and not be afraid to suggest something or to admit when something went wrong. It's critical. Just an example of, what are the features of really good teams? And this is a great book that, came out a few years back, and the movie's exceptional too. I'd like to point out, and Colonel Swain mentioned this towards the end, he said something about, not enabling things when you have a toxic leader. And this I read recently, a book by Barbara Kellerman about leadership. And she brings into the discussion followership, which I'd never heard before. And I know other people have talked about it, but she's the one that introduced me to it. Her book was. And we're followers, and we need both. We need both to be doing their respective roles. And being a good follower means not necessarily allowing a leader to have control in a way that is dysfunctional. But you can see all of these different components, which again are things that we all know, right? It's pretty standard. That's what you need. You'll see that when you see a really high functioning team. Now, I like to think of a little bit inverted pyramid when it comes to leadership, because it is essential at every level. And there's some debate about, okay, is a manager really a leader? I'd say absolutely. We're all leaders in our own way. We have leadership moments, and we need to look at ourselves and say, what am I doing in this moment? Am I leading? And so, obviously our organization is one. There's the actual clinical practice, which includes the doctors and nurses. There's the laboratory director, if you have that model, laboratory manager, the science team itself, individuals, and then you. And you're at the top here because you can influence you. You can't influence much of what's below you. You have a big part on the science team, and you may be able to manage up a bit, as Colonel Swain was saying, but you have a limited ability, so you have to really manage what you can manage. Now, I want to point out, though, that whatever environment you're in, it starts with the culture of the organization and the clinical practice. And you can't control that. And unfortunately, in addition to the concept of, say, leaders who are toxic or who are counterproductive, which I do kind of like that better, counterproductive leaders, there's also counterproductive cultures that are established by the organization and the clinical practice that make it almost impossible to be really solid. Like it's hard to be in an organization that doesn't have good culture and be that leader when everyone above you, as far as your hierarchy, doesn't embrace that same cultural positive leadership. And in those cases, you really you may have to question whether you're in the right spot, but you also have to do a lot more to take care of yourself. I was fortunate in that I was at the Mayo Clinic, which is annually recognized as one of the best organizations. And what I saw there, you know, one of their mantras, which anybody that's worked there knows this, which is the needs of the patient come first. And that culture is embedded. Now, it's not throughout. There are hot pockets where there's leaders who aren't functional, who aren't productive. But overall, it's a very productive environment in that regard. And so that's when I did my MBA and when I really started to acknowledge the importance of organization culture along with the leadership that you're sitting in. So I'm going to take another step back. You know, I took one leadership course. I've read a lot of books about leadership. I am not a leadership expert in any way compared to, say, Colonel Swain. And so I know that this is a journey that you're on. And I liked his last slide about how it is a long journey. And this is a book. I had parts of this in my MBA. I can't say for sure if it's the best book. It's one that's quoted quite a bit. But there's three elements to education of becoming a leader. First is education. What can you learn to help you be a better leader? So as you're sitting there, if you're right now, even just a junior embryologist, someone that's just starting out, and you say, yeah, I want to be a leader someday. Well, read about it. Learn about education. The Good to Great book was, we did a book club at Mayo Clinic with all of the doctors in our team and myself, and it was fantastic. That was a really good book. I highly recommend it. But those are the sorts of things you can do just to start laying the foundation for, okay, what is leadership about? Let me read more about it. From there, then you're actually in positions where you can start to get training about it. So structured skill building around leadership. And I'll talk a lot about emotional intelligence. There's courses that you can do around that, but you actually can do some active activities that build that along. So that's a training. And this, you know, is very much more the case, say, in the military, where there's leadership training that's ongoing. We have less of it in our world. It's less training available. There's more education. But once you're in a leadership position, then it's ongoing development. You have to sustain that growth. It's, you know, leadership, if you flip it around, and this again is something Barbara Kellerman talks about, is if you look at it as a profession, because it's so important of a role, it's like, what if we said to be a leader is the same as to be a doctor or to be an embryologist or any other profession where you have a certain amount of training and you actually take a test, you're certified, you actually get to that point. That means that we're never there and we're always needing to have continued sustained growth. There's a lot of talk about different leadership styles. I'm going to touch on this just a little bit. But first, back to the toxic leader. This I put when I gave this talk at Alpha last year, the elephant in the room, which is what do you do when you have a bad boss? And really, this is critical because our roles and you know, the example that Colonel Swain used of the you know, the fire and the people not trusting. If you don't have trust in that system or feel safe, that is really an issue. And currently, leadership, the prices, there's a lot at stake. And this paper that just came out in Human Reproduction, everyone should be checking it out. It's, you know, some of the people here were co-authors on this, and it looks at the UK and the US, and it looks at employment factors for what's impacting embryologist stress. And there's just a couple things I want to point out. Working overtime is huge. Even more so, mandatory overtime in the US, 48%. Inadequate holiday weekend compensation, inability to take greater. There's a lot of things here that are going to make for a very difficult environment. That means that leaders need to even be better. And it's a tough one to do because if you're a leader and you don't have the resource to do the job well, wow, you have to make choices. You have to still be strong. You have to provide that safe environment, and yet you're feeling it too. And I'll talk more about that. But the stakes are indeed high. And what can happen and what happens is we get burnout. And that's an issue. We need appropriate staffing. There's now at least 4 different groups. There's the Australian, New Zealand one in the bottom left. There's the one from Mina Al-Khani and coworkers in the US. There's the ASRM one, as well as one from the EU. This is important, and this is some general data, and you see this published a lot, is that when we talk about even at the manager level, so if you're a lab supervisor, you account for 70% of the variance in employee engagement. And we know that being engaged in our work is so important. We need to be engaged and being like, we're doing our best. We like it here. We're really, we're on the, as Jim Collins says in his book, Good to Great, I'm on the bus. He uses this metaphor of being on the bus. And that's really critical, that we have good supervisors, good managers who account for that. Now, I would say this probably isn't as much of an effect for our field, because our field is so mission driven, as opposed to, say, if you're working in a call center. Ours is mission driven, which accounts for a big part of why we show up. But our managers and our supervisors still account for a big part of that. How do you measure that? Well, there aren't great ones, but one is the Employee Net Promoter Score. This is something that we use at Genea, and it's just a way to say, okay, how is my team doing? How do I measure that? And then just as far as the leadership styles, I'm going to quickly go through this. And there's just things, different terms. There's so many, like I can't list them all. Read the books and see. But I like to subscribe to a combination of authentic and servant leadership styles. And they're really complementary. They're not redundant. Together, they create leaders who build trust through self-awareness and transparency. That's the authentic piece. And they empower their teams through service and ethical stewardship, and that's servant. Now, I'll say there's a sweet spot for these, right? Not so much for authentic, but definitely for servant leadership. You can't be an overly servant leader. You have to have that sweet spot, because you have to, you're serving your organization, you're also serving your team, and you have to be able to walk the line. And it's very, very effective, these two, in our types of work. So what makes a good laboratory leader? And there's this one thing called the Big 5 personality traits. You could take this test just to kind of see where you fit in these different areas. But as Colonel Swain said, first off, we have our technical proficiency, we have our hard skills. That means we're able to, do the jobs that you do. You want to be really good at whatever skills you're doing in your lab. But maybe you're not the best, so you don't have to be the best at everything. But you at least need to know what's important and know who's good. You need to have great organizational skills. And this I can't speak to enough when it comes to running, especially larger labs. You have to manage budgets, you have to have compliance, all these different elements of hard skills to be a good leader. You want to do all those good, although you may not be good at all of those. And so then you have to be able to delegate. And that's an equally important skill. And really, that's one of the soft skills. How you delegate is understanding your people. How you communicate is a soft skill. And what I'll spend the rest of this talk on is emotional intelligence, which I was drawn to when I first saw this published, over 2 decades ago now, almost 3 decades ago, actually. And I've believed in this throughout, and we're just gaining more and more information around that. So this is really where it started. Now, Daniel Goleman will be the first to say he didn't really come up with the term or the idea of emotional intelligence. He just happened to write about it and bring it into the mainstream, and how it matters more than IQ. So, we know that IQ is pretty well fixed, that you have it, what you've got. EQ is not, or EI, as it's more commonly called. EI is something that you can gain by learning. And what's amazing is really, this book just came out right before Alpha last year. And I grabbed it quick, read it, and I thought, yeah, this is going to be what I'm going to add to this talk, because he goes into published evidence for how EI is important and how it can be influenced and improved. So this is critical. This is something that you as an individual can now say, okay, these are areas that I can work on to get better. So here's the EI construct. And there's 4 quadrants. So if you look in the upper left quadrant, it's about yourself and it's knowing yourself. So it's self-awareness. How well do you know yourself? How well do you know when you get upset? What do you do when you get upset? What are your emotions like? Do you fly off the handle? You know, that's being aware of yourself. The bottom left one is how do others know you? And that's you understanding, well, how do other people know me? Are they seeing me as someone who is approachable or not? Am I defensive? Do they see these things? You know, so it's flipping the lens to other people, not reflecting on yourself directly. The upper right one, it's what do you do for yourself? How do you manage yourself? How do you manage your time? How do you manage how you engage with people? And then the last one is the bottom right corner is in general. How do you work with others? What's your social interaction like? And so these are the constructs, and he goes through this in great detail in the book. I can't do it justice during this talk, but I will just point out a few things that then come into play. So when you are a leader, you want to be able to have that influence. And to have that influence, you need these, to have EI. It allows you to coach better. It allows you to manage conflict in a more effective manner, inspire people, and to be that leader to get teamwork done. So these are really critical things for EI. Now, this is a Korn Ferry survey that was done. How many leaders have high EI? And so this was a survey of 155,000 leaders, and you can see here that 17% of leaders had 0 EI strengths. Ouch, that's scary. And only 22% of leaders had 9 to 12 that you would say are high functioning, and that's only 1 in 5. So what I find is amazing is that we've moved through the last 30 years learning more and more about what it means to be a good leader and how it wasn't there before. Even though there were great leaders historically and they had these things, we're just now grasping these, which means that they can be translated and you can learn about them. So that these leaders didn't have that, but now future leaders hopefully will. And that means, again, emotional intelligence can be learned. Here's just a couple papers from the business space about this. But there's also ones in our world and in medicine. And so how can you learn more? Well, I've just grabbed a couple of screenshots of programs, either very short courses or full programs. These are 2 business related ones. Here's one that was in the British Medical Journal, Learning, 1 hour emotional intelligence. First of all, let me say, I haven't looked at any of these, so I can't vouch for any of them. I know that there's an industry for leadership education, and that industry preys on the need for leadership training. And therefore, there's a lot that's out there that's not good. So, you know, buyer beware. But the fact that it's out there is my main point here. And I just show you that who is this for? And it gives you all the different types of people in healthcare. Obviously, doesn't say medical laboratorians, and yet that would fit. And then here's one from Walden University, of which I think I've heard of before, but I thought it was pretty interesting. This is a nursing-based one. But look at the titles: Managing Burnout in Healthcare Organizations, Emotional Intelligence for Healthcare Leaders, Resiliency in Healthcare. All very important topics for emotional intelligence for healthcare leaders. So there's information out there. Again, I'm not going to vouch for any of these, but I think it's worth looking for things if you're of interest and want to develop that skill. So I found this article in the Annals of Royal College of Surgery from 2014. And it speaks to something that I think we can all probably relate to. And it's the surgeon stereotype. And whether or not they're able to break that with emotional intelligence. And I'm probably not going to be overstating the fact that we probably all have experienced the surgeon stereotype with fertility specialists. They're of the same breed of surgeons. They are surgeons pretty much, all of them. And therefore, we know that this is an area that is fraught with individuals who might not have good EI and who may make unsafe environments in the operating theater or the operating room or procedure room. And the reality is, so this is 2014, and there was very little written about EI at that time. And since then, this is just 2 papers from the last 2 years, systematic reviews. All of the papers that were cited were since 2014. So again, very recently are we starting to have this information put into our area of healthcare. And it shows that it does matter, but the evidence is not as good as we'd like. They need better evidence, just like any meta-analysis, it seems, but it's improving. This paper just came out last year. It's actually from Australia and New Zealand, colorectal surgeons, and they actually applied this. Only paper I could find where they applied EI training for surgeons. And what they found was that, yay, everyone really improved their knowledge and use of EI after taking the training. So that's wonderful. The bad news of this one is that when they actually measured, are they actually applying EI? There's a test, there's this scoring system, the MSCEIT. Before and after, this was approaching significance, but really didn't move it a lot. That's in junior surgeons. And in the few senior surgeons that they had, it looks like you can't necessarily teach an old dog new tricks. Some are going to be set in their ways. And this goes back to the mantra. It's one thing to know about something and know the importance. It's another thing to do it. And it will take time. But you are young individuals, mostly on this call, who can be learning these things and applying them as you move forward. So EI leadership in the laboratory. A few key points I'd like to make. One is know your staff well. So this goes to what Colonel Swain was talking about building trust. You need to know them in order to be able to manage conflict. If you don't know their personalities, and that that EI quadrant bottom right or bottom top right is actually, what are you doing? You're knowing about your staff, you're knowing their personalities, and it's a fine line. It's difficult. This isn't easy to do. Not everyone has this ability to see what's the unique personalities they have and how can they be clear about that to help build a good culture of trust. Part of that is then embracing personality differences. The team that we have is the team that we have, and there's going to be personalities that are sometimes quite different, and we need to embrace those differences if they're not actually, like as we were saying before, I think Michael, and you asked about, not following protocols. Obviously, personality differences that fit within protocol is important and also fit within our culture. But you can't have that safety if you don't embrace individuals that are just, there's going to be differences. We have to play to the strengths of your team. And this is so critical to how you manage your team. When you're delegating, you need to know, well, who's really good at, say, running equipment and say, okay, this is the person and I'm going to glean to do that. Similarly, regulatory issues. Who's really got that skill set, that passion for dotting I's and crossing T's and doing regulatory? Put that person in charge. So that's an important EI trait. Obviously, communicating effectively. In this regard, it's communicating things that people need to know. And again, as Colonel Swain said, if you're in an environment where there's a lot going on above, and this is always the case, whether it's a good culture or say, one that doesn't have good culture, you're going to have things that are going to be happening above you, say with higher levels of leadership, that you need to protect and not let it trickle down to your team. Now, the reality is you then have that information and you say, oh, now I just have to bear that burden. That's where you have to then reach out to peers of yours, whether they're in the organization as fellow leaders at the same level, say a nurse manager that you can talk to about these things, or other people outside the organization. And crisis management. And this is where your EI for your emotion management is really important. You don't get caught up in the drama, that you're able to take deep breaths and say, okay, let's think clearly, bring somebody else in as an outsider to help with a crisis if that's needed. But be aware of your emotions. Now, all of those are layered on top of other things that are important for leadership in the laboratory that I can't walk away from without adding these. One is getting in the lab. If you are a leader who has bench time, that you're still at the bench, you need to be in the lab. You need to be leading by example. You need to be putting your hand up and saying, anytime there's something, an extra weekend. I remember when I was in New Zealand, that was when I finished my time at the bench. At the end of the pandemic was when I hung up my ICSI needles. But I was always like keen to say, yep, I'll do a weekend. I'll do it, whatever, I'll help. I want to try to give people a break. Lead by example, get in the lab. The good organizational skills are really important. They're important because if you don't have an organized lab, if you don't have an organized system, then it's chaos. And as much as you might be able to do all these other things with EI, if your lab is just running on empty because you're not organized, that's not okay. You need to advocate for your labs, advocate to senior leadership in the company. What do they need? That slide before about, the amount of overtime, that's where a leader needs to step up, and you need to step up to your leader if you don't have that influence on, say, higher levels of management to figure out how to get that sorted. Obviously, it's difficult when we have a shortage of embryologists in the world. Collaboration, as I spoke to earlier, we're part of a bigger team. We need to collaborate with our nursing colleagues, with our admin colleagues. We need to integrate with that. And hopefully we have a culture in our clinic that lets us do that. And lastly, you need to protect your time. So as much as you want to get in the lab, don't overdo it and say, well, boy, all I can do is be in the lab. You also need to say, I need at least a day to do my managing, to really replenish that and to do the work that allows the team to function at its highest level. And this is I think my final informational slide, which speaks to that. Protect your team and take care of yourself. In summary, while some leadership skills are innate, most all can be learned. The soft skills, specifically EI, are important features of a good leader. If you have the misfortune of working for a toxic leader, manage up, manage yourself, control what you can, avoid emotional labor. And when I say emotional labor, that means don't get drawn into the drama. You're going to have people that want to get drawn into the drama. You need to identify it and draw a line and say, yeah, this isn't helping things. Let's stop gossiping. Let's stop, woe is me. You need to do that yourself with other people, but not in your team. And if you are a leader or want to become a leader, understand yourself better because it will help the team overall. And I'll just end with these two books as recommendations. They're more popular culture type books. Simon Sinek's books, Eaters Eat Last. I think, I said eaters, Leaders Eat Last. I think this one, it just talks so much about, how you take care of your team. Even more so when we talk about, I think Colonel Swain was talking about the VUCA components and what does it take to have humility. And one part of that is actually having vulnerability. And that's what Brene Brown spent her career on. And it's just a fantastic writer about daring to lead and taking down these shields you build up to protect yourself. You need to be vulnerable. You need to be able to say, I don't know, and be okay with that. We don't know all the answers. And if we feel that we need to know all the answers, then we build up this layer of armor that makes it so that our teams can't engage with us. One of the examples I can think of that I've seen in many different cases, and it's cultural at times, is having that idea that I am in a society where the leader has to know all, leads to people then always deferring to the leader, as I think Colonel Swain's example also about people not raising questions when a leader is maybe going down a path. I can see it when I see people in the room not want to speak up and their eyes are looking at the leader that they report to. If that's happening, that's a sign that there's not safety in that group. So with that, I will end and take any questions and stop sharing.
Thank you so much, Dean, and thank you so much to Colonel Swain for these extraordinary talks on leadership within not just the IVF lab, but just leadership in general. I think as someone who looks after labs, they are an incredibly highly challenging, high stress environment. The stakes are incredibly high. And I think all of this is really important for anyone who wants to be a leader or is a leader, just to try and learn a little bit more about how to lead a really high-performing team in that sort of VUCA environment. So we might just start now with some questions and answers that have been coming through on the Q&A feature. Thank you so much for everyone who's sent them through. If you're popping any last-minute ones through, please pop your name down and where you're from. It would be really great if we could give you a shout-out. But I'm going to start with the first one, which I'll start by throwing to Dean, if that's okay. In the i3 Burnout survey in 2020, there was a really low level of absenteeism from scientists in reproduction, and it was really low compared to other first responder or high stress jobs. And this was attributed to this, even when things are not good, there is this incredible sense of duty and care for our patients. Do you also think, though, it could be influenced by the leadership, even though in these real high-stake environments, the leadership is also influencing, despite the fact that there is burnout there?
That's a great question, Deirdre. Thanks. I think Simon Sinek talks about your why, and our why is so strong that I do think it is the overriding thing. Now, if our why is, if we're comparing ourselves to, say, first responders, you think that why is just as great. And if there's more absenteeism there, I don't know why the difference would be. I can say from what I've seen around, having been in many different places, that I've still seen good, I think, commitment even in bad leadership settings. And so I think our why is stronger than the impact of the leader.
Yeah.
I'd love to pivot to another question that came in during Colonel Swain's talk about burnout. Really getting to the point about to what degree does bad leadership lead to burnout? There's, of course, burnout due to too much work to manage in a safe and effective manner. But then you could probably have a really easy daily workload and still get burnt out from a bad leader. What are your thoughts? Colonel Swain's muted.
On mute.
Yeah. I don't have any data on burnout specifically, but certainly the research does bear out that leaders do have a direct impact on burnout. I think just off the top of my head, while as a leader, you don't strive for likability, you don't necessarily want people to dislike you, but if you do like your leader, I think that is helpful. I'm thinking some research, warmth and competence are sort of the two factors that most personal engagements are based upon, and warmth, likability is part of warmth. And so if you don't dislike the people you're working with, that makes it, I think, less stressful, and is maybe some of the underlying reason on why burnout may be less for some of these leaders. But as I mentioned, you can be a stern and standards-based leader that people don't necessarily put high on their likability list, and those folks aren't necessarily leading their people to early burnout. So again, without any standards, I think ultimately, if the people dread going to work, that likely leads to burnout, and leaders can influence that, right? You can't control all the variables. I think, Dean, you mentioned first responders, right? I'm just thinking through some of the outcomes. You can have a great leader and just have a bad week or a bad day, right? We have that in the Army. You can do all the right things and bad stuff just happens. And if enough bad stuff happens that's beyond your control, that it just may lead to burnout. I don't know if leaders aren't a silver bullet. They can't fix everything. So that's sort of a meandering response, but I think they can help with some burnout, but they can't prevent it altogether. There's some factors that are beyond the control of the leader that I think lead to burnout.
Yeah.
Right. Can I just
go for it.
I'm just going to interject there quick. First of all, I have to say it's just really kind of surreal talking with Colonel Swain, listening and thinking I'm talking with Jason. Sorry, voice is amazing. That, what occurred to me about the difference between first responders and embryologists is first responders have a lot more trauma involved. So their jobs do involve not just, a really important role, but also in addition to the amount of work they might be doing and getting burned out is the trauma that they're exposed to, which is very different than what we have, hopefully.
Yeah. Well, one thing that I'm very passionate about, I tried to address burnout on a technical, like just a logistical level with my lab director pledge. If anybody's connected with me on LinkedIn, you can read a little bit about it, but it was really just a attempt to define some basic standards that I'd like to uphold in my lab. How many days in a row somebody might have to report to work, how many hours a day, that we're going to be staffed well enough so that somebody could call in sick. There's a number of other points, but really that tried to bridge the gap between a fleeing talent pool and let them know that there are some high quality labs in the country that will provide a sustainable, enjoyable embryology career. But it really, there is also a leadership quality that bridges that gap when the days are long and the hours are hard, and it takes resilience and perseverance. Um, a good leader can call people to do that for a short period of time, and I really think that that leadership increases what I like to talk about as a surge capacity. There's the capacity that we could do this all day, every day of the year, and we'd be good. And then there's a surge capacity, and I think uh, any team can do more for a short period of time, but somebody with a really strong leader, I think they can do a little bit more than just your average run-of-the-mill uh, team. Dean, do you feel like that it resonates with you?
Yeah, no, I agree 100%. I've gone through times in my career and still do where something happens, there's a big load or there's an incident, something that causes us all to have to step up. And when you have a really good team and good leadership, it's easy. I mean, everyone's like, yep, we're all, again, back to Jim Collins, everyone's on that bus and they're all pitching in. And so that works. If you keep having to go to that well, though, even great leaders, I think you're going to run out of any kind of collateral or ability to do that. And unfortunately, that's what our field is asking many of us to do. Depending on where you are, it's definitely not necessarily a safe environment from a staffing perspective.
So Dean, on that, we have a question here from Laura Coral, and I think it relates back into your thing about self-care. How do you manage your success as a leader and maintain your personal life balance? And what are the practices that you use to try and rebalance when you're feeling overwhelmed?
Oh boy. So I probably haven't done the best in terms of balance. My wife would say that. Yeah, I think the sense of duty is I haven't felt where I've gotten to a breaking point. So that's an important distinction to make. But it's important to speak up. You should have a boss. Hopefully you have a good relationship with that leader. And that leader is going to, like I currently do. This is actually, believe it or not, I'm near the end of my career, and the role I'm in now with Janae is the first time I truly have a manager. The CEO is my manager. And it's actually been refreshing because I have a really high EI, really good CEO. It's refreshing. And I get to share these things. So hopefully that's what you can do, is to actually get some help from that or some other mentor or coach. I have used coaches for areas where I've been challenged. So that's another area that I think is really useful for helping get through difficult times.
Great.
I've also used an executive coach, highly recommended. That kind of ties in with a little quick plug I'd like to do. The College of Reproductive Biologists are, most of our team is attending this talk right now, but we are putting together a chapter 2 of our leadership workshop. It's going to be in Grapevine, Texas, August 8th and 9th. So if you've been enjoying this, I think we can pick up the conversation there with a lot of high quality leaders that I recognize as role models. Again, I think almost all of them are attending this talk. But pivoting back to the Q&A, I wanted to ask both of your opinions on, well, somebody's put in a question on team building courses or activities. I've used them as a leader, whether it's axe throwing or some Lego building challenge hosted by ex-military leader. How have you guys used team building courses to bring your team to higher heights?
I have only done a bit. I mean, part of it is having regular social events to just keep that collegiality, to not just have it be about coming into work. But I have found that just doing escape rooms, different activities like you state, that those are just about building collegiality among the team and getting to know it. So as a leader, you get to then they get to see you as a human being, and you let your guard down a bit and get to know that and build that trust. That's what I would say.
Colonel Swain, have you engaged in many team building activities?
I've got no shortage of colleagues who run those types of things now that they're out of the military. I think they can be useful, but it's really about interaction and communication, right? You could go through axe throwing in an escape room and it could be a dysfunctional experience, right? Somebody drinks too much alcohol when they're there and makes a fool out of themselves in front of their team, right? So it's not like those things are, again, there's no silver bullet that just fixes all of these problems. Interacting with folks, allowing them or interacting with them outside of a work environment can be good, but you don't necessarily want to make it mandatory. We have a thing in the military, mandatory fun, and people almost maybe too much. Some commanders maybe try to have too much forced interaction. And that has the exact opposite response. And so I think it's knowing your team. You want to demonstrate you care. And maybe it is something like an escape room. My daughters and I love escape rooms. I make my brother and his wife and kids do it with us. I make my teams do it, but that may not be what is best for your team. And so I think factoring in what they enjoy doing, if they're going to see it as work, that may not be a great way to build that cohesion. And that goes back to maybe your earlier point about with burnout, like a cohesive team is good, right? If you feel that bond and cohesion, it's not just a task cohesion or sort of that similar mission or similar purpose that Dean talked about. There's a social component to cohesion. And so interacting outside of the office is a way to build that cohesion, and that cohesion can help buffer against some of that burnout that you'd asked me about earlier.
Yeah, I do feel like any social interaction certainly helps when you need to have a lean on that relationship to have crucial conversations. Deirdre, do you want to try to squeeze in one last question?
Yeah, I would. There's so many here, so thank you to everyone who sent them through, and we're sorry we're not going to be able to get to them all. I have one more, but then I have another final one that I will ask at the end. But this one I wanted to ask, it's from Magdalena from Poland, and she wanted to get your opinion on accountability culture and how you can build that within a team to build trust, psychological safety, but also how to make everyone in your team accountable for their own decisions and the team's own welfare, I guess, and engagement. Maybe to Jordon first.
People focus on what is measured. I think you can focus too much on measuring some things, but accountability, if you start measuring it, we'll do things. Again, different organization, and what works in my team might not work in the lab. But when we report things, if it's a board that reports our statistics, or if we're in a meeting and we are required to report certain things, people start to put their effort or their focus on what is measured. But there is a downside to that too. But that could be a way to communicate accountability. But I think Dean probably has some thoughts that are tailored more towards the lab specifically.
Yeah, that's a tough one when you've got some team members that aren't pulling their weight. So that level of accountability, and you have to have that, and it's sometimes you can identify it if you keep a really good roster, and you can see who's doing the different types of roles. We know there's some favored roles in the lab, and if an example, somebody doesn't want to work on a certain bench doing a certain task, and you can pick that out by looking at what the pattern has been, then you can have that conversation with the individual and hold them accountable. Accountability around outcomes, obviously we do that all the time. We have KPIs. So I think to Jordan's point, it's measured. But accountability in terms of culture and behavior is a bit tougher. And that's where your EI comes into play, and where that art of leading is really drawn on.
And I note the time, so we've probably got time for one final one, and it is a little bit of a cheeky one. I think everyone obviously knows Jordon Swain, who is an extraordinary lab director within America. I'm not sure if he's on the line listening this morning, but the question is for Jordon: do you think you could do your brother's job, and do you think he could do yours?
I could not do his job. He probably could have done mine 30 years ago. I don't think he could do it now. So
all I could say is, I would like to say that, so Jason, just a call out to you, Jason could have given my talk for sure. And wouldn't that have been a freaky thing? It's like, freaky. What was that movie about the twin sisters?
Brilliant. Thank you very much for indulging in that final question.
Very nice. Well, then please allow me to wrap up and thank everybody for attending. Special thanks to Dr. Morbeck and Colonel Swain for providing their fascinating insights into leadership. Thank you, Deirdre. Fantastic.
Thank you, Michael. All right, thank you. And thank you, everyone who took part in the webinar. I'd really like to, again, acknowledge these two extraordinary talks. Thank you also to my co-moderator, Michael. And thank you to everyone at I3 and everyone on the initiative, Jacques Cohen, Peter Nagy. I'm going to butcher this name, but Mary Cervantes, Thomas Elliott, Fran Farley, Violetta Sura, and Giles Palmer. I'm not sure if I was supposed to read that or you were, Chelsea, but thank you very much. And thank you for joining today. I'd also like to put in a bit of a shout out for next week for the I3 session. It's really not one to be missed. I think it's a really important one. It's all about breaking bad news, co-parenting update, and also conveying the very controversial topic of add-ons to patients. It'll be covered under the title Mastering Patient Conversations in IVF. So please join us for that one next week. And we thank you all for your time.
Thank you.